Good evening. I have question number 1 from chapter 27. Evidence-based practice is essential to transform healthcare by providing proven effective treatment. The goal is to use clinical expertise, current evidence, and client values and experience to provide quality care. There is a growing body of knowledge on computers and informatics support as nurses and other healthcare professionals develop skills and competence in the integration of evidence-based practice. Evidence-based practice is applicable to healthcare disciplines and contributes to the evolution of nursing as a profession. Research can be applied to providing care that integrates nursing experience and intuition with valid and current clinical research to achieve best patient outcomes. Evidence-based practice is a systematic process requiring some specific activities. These include asking a relevant and searchable question which determines whether change is needed and helps clarify the problem. The example in the book is asking whether the infection rate on central lines is related to the current procedure of the central line dressing. Another example more commonly used in the nursing profession is bedside report and hourly rounding. Does bedside report increase patient satisfaction and quality of care? Does it improve communication between staff and patients? Does hourly rounding decrease the number of falls that we see in the hospital? Secondly, systematically searching for evidence involves a thorough review of studies related to the question. For example, reviewing studies related to bedside report and effective communication between staff and patients. And for hourly rounding, reviewing studies looking at the number of falls in the hospitals and the time in between the staff are rounding on these patients, especially the ones that are at high risk for falls. The next step requires critically examining the evidence and the consideration of the size and type of studies examined, quality of research reported, critique of the studies, results, and recommendations. The current practice may need to be changed. This requires a redesign of current procedures and workflow, as well as timely implementation. Evaluating the effects of change and maintaining its practice is the last activity for evidence-based practice. This involves the comparison of pre- and post-change to verify the effectiveness. Do patients feel more valued and satisfied with bedside report as opposed to what we used prior to bedside report, such as just giving report in the nursing station? Is communication between patients and staff enhanced because of bedside report? And have we noticed a decrease in the number of falls or call-lights since implementing hourly rounding? In some instances, the integration of evidence-based practice can be the biggest challenge. When people are so used to doing things the old way or what they're used to, it makes it harder for change. I know some nurses that hated bedside report when it was first implemented because they felt like it would take too long giving report, especially when you had like 5 or 6 patients. But ultimately, as we know, it does enhance the quality of care for our patients and they feel more active in their care in the hospital. The systematic process of evidence-based practice in some ways is similar to the nursing process, as it requires assessment, diagnosing the problem, planning, implementation of these practices, and evaluation of the patient outcomes. It is essential for nurses and other healthcare professionals to understand how informatics advances professional abilities and search for new knowledge to advance and aid in the provision of quality patient care, safety, and outcomes. Thank you.